In this video, I'm just going to show you how I do a normal foot care service. So typically when I first meet the patient, I will do my assessment, general overview, look at their feet and stuff. I always begin with the fifth toe. I don't know, it's just out of habit, I guess. It's just kind of where I've started, and I've always stuck with it. Whether you begin with the first toe or the fifth toe is completely up to you. I like to begin with the fifth toe because honestly, it seems like the fifth toe is the easiest. And then you work up to the great toe, which sometimes has the ingrowns. Sometimes they've got the ram's horns on the second or third toe. So I kind of like to work my way to those difficult areas. Typically, I take my nippers and will cut along the free edge. I do cut pretty much as I'd like to cut down to the white line, of the nail bed. Some patients like their nails to be cut really, really short. So it just depends on your patient's preference of what they like. And if they like them cut really short, they will tell you. It's almost sometimes kind of crazy how short some people like their nails cut. But that's what they're used to, so it doesn't bother them. Other patients, if you've cut them too short, they will remind you the next time they see you in clinic that you cut your nails a little bit too short that last time, and they'll tell you. But when I do cut my nails, I take my nippers and just kind of go from the lateral edge over, and then I go across the nail bed and just kind of cut small snippets is what I cut. And a lot of times when you cut those nails, it will remove a lot of the debris that's under the nail as well. So it just depends if you need to use your spatula packer to clean out under the nail or not. I'm always cleaning out my nippers because debris gets stuck in there. So it just becomes a habit to cut, swipe your nippers. As you see, I do that a lot. That just becomes a habit of what you'll just do. And then when I do cut, I try to put my index finger over top of the nipper so the nails don't fly as much. They fly, and you're not going to prevent that, but I do try to prevent them from flying all over the place. And as you see, I wear glasses, and I also wear my scrub cap because I don't want nails in my hair. And then I will use a nail bit to file the nails down, turn on my e-file vacuum, and just file over the nail bed or over the nail itself. And with light to medium pressure on regular nails, you don't have to get too aggressive with nails that are regular and don't have too many issues. I go all along the nail, the edges, and just go from one toe to the next, filing. Typically, when patients' nails are normal, there's really not a whole lot to do as far as changing out drill bits or anything like that. Usually I just stick with the diamond drill bit, and that's usually good enough for regular nails. If she were to have something abnormal and had a thicker nail, I might have to use another drill bit for that type of nail. But for her, I just wanted to kind of reiterate with you guys, this is just a normal nail foot care session. File along the side walls as well as the free edge, and then at the back of that cuticle area we'll file as well. And then I will switch out to a skin bit for her, and you'll see I'll file her skin as well. When I do the skin, I go underneath the toe pads, kind of get that dry area, as well as I go around the nail itself, just to kind of get those walls and underneath the nail. There's some dry skin that sometimes likes to collect there, so it's a good opportunity to get that cleaned up as well. And nothing too crazy. You just go over the nail, go around the sidewalls, go down. The pinch callus area, you know, I like to go down that lateral sidewall of the toe, that fat pad space there. I like to go there, right there. Get that as well. And then I'll go along the transmetatarsal transmet area, and then I will go underneath those toe pads again. Basically, it's just keeping everything in check. The heel, go around there, and basically that is it for a normal foot care session. I will clean any nail dust off of their foot. It seems to like to collect there. I'll clean the toes, and then I'll go between each toe, and then I will go onto the next foot. Sometimes before I bring up the next foot, you'll see that I will get rid of my trash and stuff and kind of clean up my work area there for the next foot. And then that's it.